We're here at MedTech World Summit 2022 with Giovanni Lauricella, who is the co-founder and managing partner of Lifeblood Capital. Thank you for accepting our invitation for this interview.
Thank you, Ryan.
So, Giovanni, you're within the recruitment industry primarily. How is recruitment within the MedTech industry? Does it differ from other industries? Have you seen any maybe trends recently that you pick up on?
So the major big difference in recruitment is the fact that it's recruiting within a regulated industry.
Yeah.
So there are certain positions that we work with, and we focus exclusively on MedTech startups.
Okay.
So there are certain positions that you could have transfer or translate over from other industries.
Yeah.
It depends. But for the most part, especially for certain executive level positions, it's pertinent to have it come from a regulated industry, specifically the medical device industry.
Yeah.
We often see that with regulatory affairs, certainly clinical affairs, depending on the certain circumstances, R&D, manufacturing, and quality as well.
Okay. And what do you as Lifeblood Capital offer that maybe other recruitment agencies don't? What do you have special?
Perfect question. So 15 years dedicated to medical device startup companies.
Okay.
We don't deviate for that. So while the industry is quite large, also the world is quite large.
Yeah.
We don't deviate, and that's allowing us to go quite general in our approach. And what I mean by that is we like to be able to be the best friend of the CEO who's designing the startup company.
Yeah.
So we don't work with the big guys, the big companies. We have to know what all the major corporations are doing.
Okay.
However, our exclusive focus on MedTech startups allows us to be the best friend of the CEO, as well as even the investors who are assembling the future of these startup companies. So literally designing the teams alongside the executives. What do you need at certain milestones based on the money that you have in the bank, what capital you've raised, and then what do you need to hit that next milestone with? So in terms of our differentiation, I think our very strong focus is a major differentiation, and the fact that we don't leave the startup community.
Okay, so you're always ingrained within.
Correct. And that also allows us to go geographically quite wide. So we work in North America. Obviously, we're in Malta right now, so we're here in Europe. Israel will actually be there in a couple of weeks as well, and then certainly the eastern side of the world. Right. So by focusing in MedTech startups, it allows us to go both geographically wide, but also not have to focus on a certain level of position or even a certain function. So we literally do C-level down to entry level, and everything from early stage R&D through multinational commercialization, including independent board members.
Interesting. Okay. So two things maybe that I want to ask you about. The first thing, you've mentioned geographic. Basically, you're well-traveled. Your company is quite global as well. Do you see any differences between perhaps Europe, North America, Asia, in terms of hiring, recruitment?
Yeah, the major difference always will come down to money and time.
Okay.
There's a huge differentiation between costs of employment or costs of talent, if you will, in Europe versus the United States, for example. Right now, because of the MDRs that were implemented a year and a half ago at this point, we've seen more and more companies take an FDA focus, as well as start expanding their teams in the United States. For years, we've been doing both sides of the Atlantic between building teams that were and stayed in the United States, and even US companies pursuing CE mark over in Europe.
Right.
The major challenge there is, even though the talent it could be apples to apples, meaning excellent talent on both sides of the ocean, the costs for those employees are drastically different. We also deal with resignation periods that are timely, right? So typically, and it's a generalization, we have a 2-week resignation period in the United States, depending on the level of the individual, also the relationships they want to manage. Sometimes it's 3 to 4 weeks that they'll give out of respect if they leave in the United States. In Europe, sometimes it's mandatory by legal statute of a month, 2 months, sometimes 3 months. And then uniquely, we've seen it numerous times, it's 3 months from the end of the quarter. So for example, if you just make a hire in July, it could be upwards of close to 6 months before someone actually is able to start. So we don't have those things in the United States, but also our employment costs much more. So if there's an engineer, and I'm making up the apples to apples, a 5-year engineer in Boston may cost you anywhere between $120,000 to $135,000.
Yeah.
Let's call it a mechanical engineer. That same engineer in Europe could cost anywhere between 65 to 85,000 euros.
Right.
And that's the major difference that we deal with. And so when we have a US company, for example, building a secondary site or even expanding into Europe, it's usually an upside for them because it's in their minds cheaper talent.
Yeah.
Now with these MDRs in place, a big thing that we're consulting some of our startup companies with is as you are expanding from Asia, from Europe over to the United States, you're going to get this sticker shock of how much they're going to cost. So, when the CEO is making 250,000 euros in Europe, and they want to go hire a head of commercialization that's going to cost them $350,000 or $400,000.
Wow, okay.
All of a sudden, this external first hire in the United States may be one of your most expensive, if not the most expensive employee in the company.
And I guess especially, COVID has significantly pushed remote working. Has that been an issue for MedTech companies, or is it especially an issue, for example, for, I guess, US companies hiring maybe out with the US for remote working?
I've heard very similar stories, honestly, across the globe at this point. And if we stay focused on Europe and United States for the time being, and we'll throw Israel in there, they followed major trends, meaning obviously everyone was home.
Yeah.
With the exception, and I actually just talked to a startup here a few weeks ago that talked about the fact that their entire engineering team had to go in and they had to figure out shifts of who was going to go in when in the early part of COVID because the operation would literally have stopped.
Yeah.
So they had to figure out who was going in, when they were going in, taking shifts. So there was some aspect on the engineering side that people had to be in the clean rooms or had to be in the office. It was obviously a smaller portion, but for the most part, everyone was home.
Yeah.
Then we started seeing this gradual shift of people starting to come back into the office. Yeah. The uniqueness about this whole thing now is there's all these questions. Is virtual here to stay? There were virtual companies before COVID.
Yeah.
There's going to be virtual companies on the other side of this post-COVID. However, we are seeing a much more strong pull back to the office from the companies themselves.
And do you think, maybe something fairly recent, Elon Musk has, for Twitter, sent the email to the employee, look, you need to come back to the office. Do you think that there will be a ripple effect into the smaller companies which maybe were hesitant before because of pushback perhaps from certain organizations? Do you think that this will have an impact on people now moving back to the office as well because the big companies are doing it, so should kind of we? Yeah,
when Elon Musk sent the email, but then if we look back in 2020 and 2021, there was these big headlines of Apple signing regulations or rules or policies that they're going to leave their employees home for the next 2 years or whatever it may be, right? So there was all these crazy things that are ebbing back and forth. And I think over the past, now is it 2.5 years, it's a strong situation that we basically know that there's change happening regularly. Things are here and then all of a sudden they're changing again, here again, then they're changing again. So I think change is what we have to embrace. I think change is what, and also the fact that not everyone has the answers, and so we're all just trying to figure it out. And as cliche as that is, I think now that this major change of COVID setting in, these dark days of it being here, leaving, coming back again, leaving, coming back again, and then now let's assume that we're on the better side of being out of it. I think we all have an opportunity to figure out really what works and what doesn't work and what is optimal. I'll speak, I love saying my truth and I'll speak very directly on how I run my company. I'm a people person. I love being in front of you here right now. I love being in Malta. I love traveling. I love being in front of my clients. I love being with the people that I'm making decisions with. Hiring an external, completely virtual team, even for my company, there's things that happen around the water cooler. There's things that happen over coffee. There's things that happen when you need to run out and ask a quick question to somebody that an email or a text message doesn't necessarily give you everything that you need. So I'm a big, huge proponent on the office setting. And I'm also about the fact that there is life flexibility, right? I mean, I have a son. My partner has a couple sons, or a couple children rather, and life happens.
Yeah.
So, are the days of if you're 5 minutes late after 8 o'clock in the morning, and if you leave 15 minutes before 5 or 5:30, whatever it is, you start getting penalized. I think those dogmatic days of that kind of office culture, I think those are gone.
Yeah.
I think we're a little bit more human now.
Yeah.
But I don't think that 100% virtual company is the answer.
Yeah.
At least for me.
It's a question of adaptation, being able to adapt to your employees, the employees' needs, isn't it? And that lets you kind of be as flexible as possible, treating them as humanely as possible. And obviously, if you love your employees will certainly love you back.
Yeah.
Going back a bit to...
And I'm sorry for cutting you off. I would like to say two things too, because we deal with this a lot, especially with our companies. Within medical device startup companies, there are clear exceptions to that rule.
Yeah.
So if you're looking to hire a head of commercialization and your company is based in San Diego or in Malta, and that person's life is responsible for traveling throughout that geography, meeting those hospitals, meeting those customers, whatever it may be. If that person has a family or whatever it may be in Tennessee and they need to move to San Diego to be in the office and headquarters when they're really traveling 95% of the time anyway, you're going to miss out on the right talent for your company if you're forcing people to move for the wrong reasons.
Yeah.
I mean, at the end of the day, if someone's traveling 50, 75% of the time outside of the office, and they just you want them in the office to see them once a week or once every other week or once a month, that's just an extra trip that they're more than willing to do, especially on the clinical research and trial side as well, when they're traveling to hospitals, sites, et cetera, seeing patients, being with whomever they need, to be honest with you. But the point is you have to design your team appropriately with common sense. The ones that are belonging in the office should be in the office.
Yeah.
The ones that don't have to be, it's a question of, are you willing to trade off the talent just so that you move them or not?
Yeah, that's interesting take on that. And going a bit back, so Lifeblood Capital basically focuses from your CEO down to the
entry level.
Yeah. So in essence, do you find it hard, for example, getting C-level execs going to startups where, let me rephrase that, C-level execs from the bigger companies, the more successful, the ones that you probably know that are going to be there for the long haul, and kind of go to these MedTech startups where, the future is quite uncertain. Does it take a particular person to be able to take that risk?
100%. It's a question of DNA and personality. So we see, I wouldn't think that the CEO, who's currently Jeff Martha of Medtronic, would be a CEO of the startup next.
Yeah.
I don't think that style of career change is going to happen. But we often see executives in large organizations. One of my favorite examples and one of my favorite human beings, Todd Usen, came from Olympus. He was an executive there. If you look back at his career, he's currently the CEO of Active Surgical, but he had a long corporate career and then made the leap into being the CEO of Active Surgical. And so I was with him a couple weeks ago in Boston and seeing how his ride and journey is. And he looks at it as sales and entrepreneurship, right? I mean, it's a different mentality in terms of having the huge company resources versus the smaller company grind. But it also takes the same style of skill sets that if you're going to build, or if you're going to build a team, if you're going to build the right team, or if you have that, I don't need to be confined by policies in order to show off what I can do as a talent myself, that's transferable. And we often see that very successfully transfer from large companies into smaller startup companies.
Cool, interesting. And how is conference like MedTech World Summit, we're here today in Malta, how does that help you reach your goals and for Lifeblood Capital?
We're at this conjunction of bringing Europe, Middle East, people from the United States, North America. We're building an international presence here at MedTech Malta, and it allows us to be, like you said earlier, back in person.
Yeah.
Seeing people, having another venue, a beautiful venue. It's a beautiful day here in Malta today. It's a great reason to bring other people from our industry underneath one umbrella or on one island.
Yeah.
And so my suggestion, we'll be in Israel in a couple of weeks at a great conference that's been around for a couple decades almost, more than a couple decades. There's some great venues that have taken place in continental Europe, over in the United States as well. Malta has a lot to offer. Great people, a wonderful island, great cuisine, and then even the logistics of getting here is very simple and straightforward for a lot of different parts of the world. So creating this island of MedTech for Malta or MedTech in Malta, and I think that's really great that if you could play off that Malta and MedTech. It's another great venue to bring thought leaders in the industry together for a few days to share, and then go back to their respective places to start building up.
Yeah, and like you said, that's what we're trying to do. We're trying to literally connect the whole globe, basically on the small island. We're finishing off these interviews by basically asking the interviewees one question, which I think, people of your caliber, loads of experience, very successful. I think you have a lot to offer to future generations as well. So my question is, what one piece of advice would you offer future health tech leaders?
Future health tech leaders. So I run a podcast called MedTech Money.
Yep.
I interview many different entrepreneurs, thought leaders in MedTech who have raised capital successfully, as well as the investors who deploy money within these startup companies. And a topic, and by the way, I'm coming full circle on your answer.
Yeah.
A topic that comes up very often is you can make a lot of money in other industries. Yeah. You can make a lot of money faster and more money in other industries. I have a very good colleague of mine who basically does what Lifeblood Capital does in another industry, in the SaaS industry. We deal with, in MedTech, we deal with years because of the regulations, and we deal with millions, typically speaking. We don't hear too many billions in the medical device industry, but we deal with millions. In SaaS, you're dealing with much shorter timeframes and billions. And so I was talking to that particular person, I was talking to these executives that I interview often, and I look in the mirror every day myself. If you don't love medical, if you don't love healthcare, if you're in this industry for money, and you think that this is how you're going to rise up very quickly and make a lot of money, there's money to be made in MedTech, for sure. It's going to happen, especially if you stick with it and are habitual with it for the long run. But there has to be something more to being in this industry that drives you for the impact. And as cliche as this word impact, because many people are using the word impact, it is true for me. I love being able to see technologies, or at least build teams that build these technologies that ultimately are doing amazing things. And I think if we make it super personal, we all have friends, we all have families, we all are individuals, and there are times throughout our lives that we all go through a healthcare problem. And being able to say that you've affected the ability to have someone be cured, healed, faster, better, reversed a terminal illness, for me, that's why.
Yeah, I guess like you said, health basically affects everyone. So whatever you do, you're pretty much affecting millions, if not billions of people.
Correct.
Globally.
It has to be your purpose. I mean, you have to love people, and you have to want to help people. And I think that's the underlying purpose of this. If you're in it just for the money or for anything else, it's there. There's other industries that you can do it faster and probably get your limelight a lot quicker. But I do this for the people.
Right. Thanks a lot for your time today. I'm sure the viewers at home will love this interview, and we'll see you on stage on MedTech.
Thank you, Ryan.
Thank you.